Kabilang ang Tacloban City sa Leyte sa mga lugar na nakararanas ngayon ng pagtaas ng COVID-19 cases. Sa report ng OCTA Research Group, nakapagtala ng 35% increase sa mga kaso sa ikatlong linggo ng buwang ito kumpara sa ikalawang linggo. Kaugnay diyan, kausapin natin ang Mayor ng Tacloban City, si Mayor Alfred Romualdez. Magandang gabi po sa inyo, Mayor Romualdez. Can we begin po with this? Meron po kayong announcement kanina na ginawa sa Facebook. Ang sabi po ninyo, kung pwede, kung wala namang mahalagang important business, wag nang pumunta ng Tacloban. And for Taclobanons, yung mga constituents nyo, wag na silang lumabas ng lungsod. Is that accurate, sir? Is that what you announced, and why did you say that?
Yes, I said that because in the region, we are the capital city and the major hospitals are here. And in fact, about 90% of dialysis centers are also in Tacloban. So we have about 350 patients for dialysis are entering daily the city of Tacloban. But I'd like to point this out that in fact, it came out earlier in your network. In fact, I read the news, I think it was February or March, when Sinovac came out. A lot of people here were hesitant sila magpabakuna, especially the healthcare workers because of the efficacy level, no? And why we're having difficulty now is that from what we see, about 90% of all health workers, doctors and nurses that completed the first and second dose, nag-positive sila. And it was, in fact, we were all caught by surprise that it's really quite a big number. And they also affected their families. And the good thing about it, ang maganda lang dito, it's that 95% or almost 99% are asymptomatic. But alam nyo, yung pahayag ni Presidente nga dyan na striktuhan at talagang anuhin natin yung mga tao na magpabakuna. Ako nakikita ko walang problema. Marami naman gusto talaga magpabakuna. Pero I think more information should be given to them. Especially kung nagpabakuna ka after the first shot, you should rest for about 1 week. Because what we saw here, immediately after they got vaccinated, nahawaan kagad sila after 5 days, 6 days, they caught the virus. So, and even after their second shot, marami rin ganun rin, nag-positive a week later, no? So nakikita namin na talagang they have to know that pag nabakunahan ka, hihina ang immune system mo, magpahinga ka muna. Isa yon. Pangalawa, kailangan talaga itignan natin kasi marami, lalo na health workers, they have a different preference, no, for what vaccine they want based on the efficacy level, no, na hinahanap nila. Kaya ito yung nangyayari dito. Marami naman na nagwe-wait and see because they feel that there will be a better choice later on. That's why they're waiting. But doesn't mean na ayaw nila magpabakuna. Marami nag-iintay lang talaga ng parang preference nila. Lalo na ngayon, marami rin nagsisisi. Parang marami may gusto ng Pfizer, pero na-commit na sila sa Sinovac, hindi na sila makaibang vaccine. So, that is what's happening on the ground. Yeah.
Mayor Alfred, yung karamihan ng case spike nyo, you're saying that these are the healthcare workers, the doctors and nurses who went back to work immediately after the second dose. Is that what you're saying, sir? And can you tell us, just to clarify, to make it really clear, what vaccine did they have?
Most
Was
of
it
them,
Sinovac or AstraZeneca?
Yes, most of them chose Sinovac. In fact, most of them chose Sinovac because it was the one available in terms of number. Marami din available na Sinovac. At nakita nila kasi na less naman yung side effect. So may nag-Sinovac. But mostly because it was available and A1 was priority. So to to avail of that, marami sa kanila nag-avail, no? Lalo na nung nakita nila yung PGH, yung doktor mismo dun, talagang Sinovac siya. Tapos nung nakita na in the beginning,
Sinovac sila, that's true.
we pushed for Sinovac. I myself, Sinovac na ako, sinabi ko, it's effective. But I think a more campaign and kailangan ma-inform talaga ang tao that, yes, you have a better chance of surviving the disease, but when it comes to passing it on to someone else, mukhang nakikita namin dito maraming nahahawa. So, ang nakikita namin dito na we're convincing the people now that yes, the campaign, it's true that we really want to achieve herd immunity. But how can we do that if we see that marami pa rin nagpa-positive? So kailangan talaga yung campaign na strict face mask and in fact face shield is mandatory dapat sa ospital yan
Yeah. Mayor Alfred, what you are saying naman po is that you're not trying to say na hindi magandang vaccine ng Sinovac. All you're saying, and allow me please ask you to clarify this, all you're saying is that whatever vaccine brand any of us take, it is obligatory on our part, obligasyon natin to still practice the health protocols and health standards.
Well, yes, and that's one, no? Pero I also go back to the report initially given by FDA that Sinovac really was not recommended for frontliners. But because it was the only vaccine available, yes, it's helping us now in terms of nagiging asymptomatic yung mga nagpa-positive, no? But if we're looking at herd immunity, then that's a different story. Maybe, with a better vaccine, with a higher efficacy level, and it's given to A4, A5, etc., then we have a better chance for, and I'm saying that baka mas effective pang ang Sinovac sa mga A4 onward. Pero health workers, I think, kailangan medyo specialized na yung vaccine nila.
Yeah. Okay, at least yung mga A4 and down, well, A2, A3, hindi naman sila nasa ospital, hindi sila healthcare workers. But anyway, Mayor, nabanggit niyo na rin po yung so many numbers of patients that are going for dialysis in the hospitals in Tacloban. Can we go very briefly over the status? What is happening in the hospitals? Full na ba yung mga COVID wards, yung mga COVID ICUs? And at the same time, may balita na the wait list is long, pero walang mga tents daw sa labas ng mga ospital. So people are just waiting to get into hospitals. Ganun po ba? Is that what is happening in Tacloban?
Yes, in many cases, that's what's happening because it's really the capital city, Tacloban, that caters to 6 provinces. So marami nagbabiyahe na mga 1-2 oras dadating dito and they need hospital, care. And many hospitals can no longer accept them. So nagkakaproblema tayo dyan And but there are many hospitals naman na hindi naman in that case na nagiging some of them are in hotels, some of them are staying. Kasi what's happening now like for example in the island of Samar, that's 3 provinces, there is only 1 dialysis center there to cater for 3 provinces, And so marami talaga pumupunta sa Tacloban. So if you really look at it, even before COVID, kulang na rin talaga ang mga ICU, mga beds. It's tama lang ito, I would say for Tacloban and maybe 1 province. But if you have 6 provinces, that the capital cities catering po, nahihirapan po kami.
And that is the sad and unfortunate reality of the pandemic. It has heightened even further yung lahat ng kakulangan natin sa healthcare system. But Mayor, also I wanted to ask you, nabanggit niyo na rin po yung vaccination sa mga healthcare workers. But the general population of the city of Tacloban, can you give us a rough estimate what percentage of the population of your city has been vaccinated?
Okay, it's ongoing now. When we talk of the first dose, we've hit about 16,000 for the first dose. And for the first and second dose, maabot na tayo ng mga 13,000. So, but this week, we're targeting another first dose of about 8,000. And second dose is going to come the following week.
Pero ano po yung population nyo? So itong 16,000 na first dose and yung 13K na first and second dose, what percentage of the population?
Well, it's about, our population's about 300,000.
Oh, okay. Anyway, and lastly na lang po, Mayor Alfred, whenever someone mentions or says the name Tacloban, the first thing that comes to mind really is the horrible aftermath of Yolanda that happened in your city. So everybody remembers that Yolanda on November 2013. But how would you say, because you were mayor at that time also, how would you say you are coping now compared to how you coped during Yolanda?
Well, it's a big difference now because especially, we're getting a lot of cooperation naman, no, from the citizenry. Lalo na kitang-kita niya nung tumaas ang cases namin, you can really see it in downtown, especially at night na maybe one car going around and, it's like a ghost town because people are afraid. So you can see that now they are responding. They just want to be informed. And ako naman, I try to be as transparent as I can. I'm not a doctor, I'm not a scientist, so I just report to them what I see. And, it's unfortunate na nakita natin itong mga health workers na nag-positive, tapos pagod na rin sila. So we're augmenting more people there na yung mga ibang nurses nga, sanay sila magtrabaho as clerk, ibang trabaho nila, pero we're asking them now to volunteer para makatulong. And many hospitals naman, nangyari kasi bumalik na rin yung mga inaugment na mga health workers sa NCR. Nakabalik na rin dito, natapos na rin ang quarantine nila. So tumutulong din sila. But also, hospitals are really in bad need of that high flow oxygenator or this
Nasogan.
all this equipment. Malaki rin ang kulang, malaking kulang.
All right. Mayor Alfred
may I add
Romualdez of the
lang
City of
that,
Tacloban.
Today, what we see
Yes,
now,
go ahead
we have
po.
more recoveries than people that are getting positive. Starting today, we have more recoveries. Bumaba na nga from 700 plus na positive, nag 500 na lang kami today.
Well, that's good to hear. Mayor Alfred Romualdez of the City of Tacloban. Sir, maraming salamat po sa inyo. Thank you for your time tonight.